Hello and welcome to a new lesson in psychology. In this video, I'm going to talk about abnormal behavior. We will know the definition of psychological disorder and perspectives of the causes of psychological disorders, such as a psychoanalytic perspective, learning perspective, cognitive perspective, and other. Then we will know the psychological disorder classification of psychological disorder, such as anxiety disorders, somatoform disorders, dissociative disorder, mood disorders, and schizophrenia. Now, defining psychological disorders, there are problems in defining abnormality and normality. This means that it is difficult to define normal and abnormal because it's vary from person to person and also from situation to another and conditions. But in general, we can say that normal is seen good thing and something that is natural, regular and routines, and abnormal is any kind of activity that isn't good or that isn't common or regular. Abnormality and normality are difficult concepts to define. Human behavior is dynamic. Why it is dynamic? Because society is dynamic. Therefore, before labeling a behavior as abnormal or normal, one has to look at the changing values in the society. Why? Because one criterion in order to classify a behavior as abnormal or normal is violation of socially accepted expectations. This means that normal behavior is socio-cultural accepted in the culture the individual lives. For example, eating spiders not normal in the most cultures, but in some groups in the rainforest, for example, it's normal because it is accepted. So that abnormal behavior is any behavior that deviates from what is considered normal. There are 4 general criteria that psychologists use to identify abnormal behavior. The first is a violation of social norms, statistical rarity, and personal distress, yes, and maladaptive behavior, and other. Then we conclude that there is no one and universally accepted definition of psychological disorder, but there are many components of the widely accepted standard definitions. These components are: the first is persistent emotional problem and suffering. If a person or individual has an emotional problem and there is a continuity in this aspect or in this state, then this will be an indicator to the psychological disorder, and behaving in a way that is disturbing to others or disturbing for him or herself. There is a state of failing to perform ordinary day-to-day activities at home, at school, at workplace. The capacity and ability of this person or for the individual is very low. He is failing to perform and to do his or her ordinary day-to-day activities. We can say here that he has, or she has maybe, has what a maladaptive behavior, and being a rational thinker or excessively lacking in self-control. He is thinking in a strange way, so that he has a defect in self-control and there is a defect in his balance. So that with these components we can define and classify the abnormal from abnormal behavior, normal and abnormal behaviors. Now let's talk about the perspectives on the causes of psychological disorders. The first one is the biological perspective. The biological perspective looks at the causes of psychological disorders from multiple viewpoints. These are brain damage and infection, genes, and biochemistry. Brain damage abnormal behavior can occur if the structure of the brain is damaged. Brain damage is an injury that causes the destruction of the brain cells. There are many types of brain damage and injury. The first is a traumatic brain injury that is caused by the external force, such as a blow to the head. And maybe because a car accidents, sports injuries, falls or accidents or physical violation. The second reason for the brain damage is acquired brain injury. That's most often associated with the pressure on the brain and which is caused by exposure to toxic substances, infection, and stroke and heart attacks and, for example, abuse of illegal drugs and other reasons. The second viewpoint of the biological perspectives on the causes of psychological disorder is infection. Some forms of infection can give rise to types of mental illness such as schizophrenia and general paresis. Let's take an example for infection, the type of streptococcus bacteria that's associated with a specific type of disorder such as pediatric autoimmune neuropsychiatric disorder. This kind of bacteria may be linked to the development of obsessive compulsive disorder. The third biological reason for the psychological disorder is genes. Research suggests that some people may be genetically at risk of developing a certain disorder. This is explaining the heredity factors. Biochemistry reason for psychological disorder that is explained by neurotransmitters that are thought to be imbalanced in the nerve system of people who have some psychological disorders. The second reason for psychological disorder is the psychological perspectives. These psychological perspectives are psychoanalytic perspective and learning perspectives, then the cognitive perspectives. According to the psychoanalytic perspective, as we have already shown in Freud's theory, that the human being's mind consists of two parts, the conscious part or conscious mind and unconscious mind. And the unconscious mind consists of three parts. The first is id and the second ego. The third one is superego. These are considered as the component, yes, of the psyche for any human being. So that a human psyche personality has more than one aspect. This psyche constructed into three parts which they interact together. Now, the first part of any psyche for a human being, according to Freud, is id. It is the instinctual part of the mind which contains aggressive drives and hidden memories. The second one is ego. It operates a moral conscious and it mediates between the id and external world and society. The third one is superego. Is the realistic part which contains principles, values, society norms, moral tradition, and ideal. It conveys the ideas and norms, moral traditions to the ego. So that it is considered as a store of instincts and ego a store of reality. Superego is as morality. Then the abnormal behavior is caused by the ego's inability to manage the conflict between the opposing demands of the id and the superego. So that there is a conflict between the instincts of the human being and the morality of the morality of a human being. Then when there is a inability to manage the conflicts between these aspects, then abnormal behavior is occurred. Then how people resolve emotional conflicts during childhood affects there. According to the learning perspectives, most emotional and mental disorders arise from inadequate or inappropriate learning. People acquire abnormal behaviors through the kinds of learning or imitation, thoughts, and behaviors for the rest of their lives. Cognitive perspective explains the cause of psychological disorder as whether we accept or belittle ourselves contributes to our behavior. Then what does accepting yourself mean? Acceptance for yourself is the ability to unconditionally value all parts of who you are. That means you acknowledge of yourself the good and the things that need improvement. Then the second part of cognitive perspective is overestimation or underestimation of yourselves has a profound effect on your or our mental health and social effectiveness. Here, although low self-esteem is not categorized as a mental health condition in itself, there are clear links between the way we feel about ourselves and our overall mental and emotional well-being. Self-esteem is defined as how a person feels about his selves and what they do. So people with high self-esteem believe that they are good persons and they can recognize their good qualities and will generally strive for a happy and successful life. But persons with low self-esteem have negative feelings about themselves, believing that they are not happy and they aren't in happiness and a successful life. There is, in addition, psychological studies indicate that low self-esteem in childhood and early adulthood can be a predisposition to addiction in later life. And many addicts use substances such as drugs or alcohol to help ease to negative feelings they have about themselves. But over time, this method of escapism develops into an addiction, and of course, this has detrimental effects on their already depleted self-esteem levels. And low self-esteem tends to work in a vicious cycle with other mental health conditions like depression and anxiety. It's hard to say which comes first, only that the combination is both common and troublesome. Someone who already lives with a mental illness may find that low self-esteem develops due to the social stigma surrounding mental illness. Example, consider a student who fails a difficult exam in medical school. He decides that he doesn't have the capacity for college. Then he becomes depressed and gives up trying to stop his self-defeating tendency. He must first stop attributing his failure to lack of ability. This means that this student belittles from himself. He must be more confident and stop attributing his failure to lack of ability. And he must enhance and raise his self-esteem and must attribute his failure to external attribution, such as strategies of learning, numbers of studying hours, and studying conditions, and other. Now, the interpersonal or family system perspectives in or on causes of of psychological disorder. It assumes psychological disorders arising partly from a person's network of social relationship, the most important being the family. This means that many psychological issues begin early in life and stem from relationships within the family of origin or the family one grows up in, even though these issues often surface later in the life. Families in conflict for individuals with issues and concerns related to their families of origin can benefit from family systems therapy. This treatment approach can be helpful for such mental health conditions as depression, anxiety, personality disorder, addiction, and food-related disorders. Family system therapy has also been shown to help individuals and family members better control and cope with physical disabilities and disorders. The sociocultural perspective on the cause of psychological disorders assumes that mental illness would result from such social problems such as poverty, poor nutrition, inadequate housing, crime, and discrimination. This perspective shows that most aspects of mental illness and psychological well-being are influenced by these factors and others such as social factor, gender, social class, race and ethnicity, and household patterns and social institutions and other reasons. The primary evidence in support of this view is the generally higher rate of mental disorders among the lowest socioeconomic classes. These disorders, such as schizophrenia and alcoholism,